Safe Patient Ratios, a Patient Safety Issue by Ashley Palmisano. Hi everyone, my name is Ashley. I am a current RN to BSN student at University of Buffalo, and I just graduated in May from NCCC with my RN, and I passed my boards in June. I shortly after that started my first job, and within that short period of time, about 2 months, I've already noticed that safe staffing is something that is very important to me and something that affects the care that we are able to give our patients. And that's something that I would like to explore during this presentation. So, enjoy! It has been proven time and time again that safe staffing allows for better patient outcomes and better job satisfaction within nurses. The American Nursing Association states that unsafe patient ratios can lead to nurses being overworked and thus leaving patients at risk of contracting hospital acquired infections, longer hospital stays, and even death. Charge nurses have to decide patient load, what nurse gets what patients, and most of the time they use the nurses that they have and divvy up the patients. However, this is not the safest way to decide patient assignment. In the article, the influence of appropriate safe staffing and healthy work environments on patients, it suggests that when deciding patient assignment, a multiple factors should be weighed, including patient acuity, nurse experience, and the ability for the nurses to work as a team, and the support the unit has on education. Another article, The Effects of Nurse Staffing on Quality of Care, states that lower RN to patient ratios is shown to decrease patient mortality by up to 50% and can lead to greater job satisfaction, decreasing turnover, and leading nurses to stay in their job longer, becoming more skilled. Take a moment to view these proposed federal RN to patient safe staffing ratios. How many of you work in any of these specialties that have more than these patients on a regular shift? I know that I do. Is this what's safest for our patients, or is this what's safest for hospital bottom line? Safe staffing initiatives are something that is not new to the healthcare field, but it is a problem that continues to rise. Many states are currently suffering a short staffing crisis, and the patients are suffering. Many people have been advocating for these changes for a lot of years. However, financial setbacks and less nurses in the field make it hard to achieve these goals of proper patient to nurse ratios. And despite many initiatives, safe staffing continues to be an issue many nurses spend their entire careers fighting for. An article from Castillo in 2019 states that nurses would rather forego the swag they receive in their workplace in return for safe staffing. In order to measure if this is working, we must create an aim statement. My aim statement is that by January of 2020, each nurse on this unit will have less than 6 patients per shift at any given time. This is a measurable goal that we can decide works after the time period. The PDSA cycle is one that we could use to try to implement safe staffing in our workplaces. Plan, do, check, and act. Plan what you would like to do, implement the plan, check to see the results, and then implement this. Using the PDSA cycle, my first strategy will be to implement safe staffing with one nurse and survey this nurse for job satisfaction after a few shifts of 5 patients or less. I will ask specific questions on stress level and job satisfaction to see. Next, for strategy 2, I will survey the patients who had this nurse and determine if this patient is satisfied with their treatment. I will ask specific questions based on how fast their needs were met and if they had any unsatisfactory occurrences. After a month of implementing this, I will count up the nurse-related patient errors and compare those to the month before to determine if patient safety is being positively affected.